Hey, what's up guys? Welcome back to the upper hand. So today we're talking about neural flossing in the upper extremity, more specifically flossing the ulnar nerve in the arm. Stick around because next we're going to talk about exactly what neural flossing is, why you might use it, and how to perform it. So neural flossing is an active assisted range of motion technique in which you can self-glide a particular nerve through its surrounding connective tissue or through its tract in the upper extremity. You can use this to help reduce or alleviate symptoms or pain associated with that particular nerve that you are flossing. This may be useful if you have some sort of nerve pathology anywhere along the track of that particular nerve, whether it's more proximal, such as a brachial plexus issue in your shoulder, or an issue further distally, such as an entrapment at the elbow or at the wrist. So now we're going to talk about how to perform ulnar nerve flossing. So you want to start out with your elbow by your side, flexed at about 90 degrees, just like this. You want to have your palm up, just like you're holding a plate or a tray. And then you want to take your ring and your pinky, or ring and small finger of this hand, and you want to kind of hook down on them slightly with the fingers of your other hand, just like this. And you want to slowly take your wrist as you're flossing into slight extension, just like this, and then back to neutral. That's the first part of this floss. Then you want to also slowly and just slightly extend your elbow, and then take all that back to its starting point. So you're coming into slight wrist extension, slight elbow extension, and back to its starting point. And the last component of this nerve floss is to take your ear to the shoulder of the side that you're flossing, just like this. And you want to do all that together in one smooth motion. So you want to do slight wrist extension, slight elbow extension, cervical side bending here. Then take it back to its starting point. Wrist extension, elbow extension, side bending, back to the starting point. And you want to perform this slowly and steadily, back and forth, for about 30 to 60 seconds. Just like so. I'm going to show you a side view of this nerve floss that you can just get a different perspective of it. So you can perform this floss for about 30 to 60 seconds, maybe 2 to 3 times a day, or as prescribed by your physician or your therapist. When you're performing this neural flossing, you should not have pain. Now you may feel a pulling sensation or a stretch along the area of the arm or hand that is supplied by the nerve that you're flossing, but you should not have pain. If you have pain while you're flossing, or you have prolonged paresthesias, which is pins and needles, tingling, numbness, after you stop flossing, then you should consult your physician or your therapist. And if you're a therapist teaching this neural flossing technique and your patient has reproduction of pain or paresthesias, as we just mentioned, then that may merit further evaluation of the upper extremity to assess why this may be happening. So I hope this video was helpful for you, and if you enjoyed this video, check out our whole library of videos on the upper hand. We'll see you guys next time.